This lecture is about the pelvis. The pelvis consists of a bony structure called the bony pelvis. Beside bony pelvis, it consists of joints, muscles, blood vessels, and nerves. The bony pelvis or pelvis skeleton consists of the pelvic or hip bones, sacrum, and coccyx. The pelvic bones articulate posteriorly with the sacrum at the sacroiliac joints. Anteriorly, two pelvic bones articulate each other at the pubic symphysis. The sacrum is unpaired bone. It is formed by fusion of the 5 sacral vertebrae. It has pyramidal shape, and because of that, we can describe base, apex, pelvic or anterior surface, dorsal or posterior surface, and 2 lateral surfaces. The base of the sacrum articulates with the body of the 5th lumbar vertebra. The apex of the sacrum articulates with the coccyx. The base of the sacrum is presented by the superior aspect of the body of the 1st sacral vertebra and is flanked on each side by an expanded wing-like transverse process named the ala of the sacrum. The anterior border of the vertebral body projects forward as the sacral promontory. The anterior surface, named pelvic surface, is concave. There are 4 pairs of anterior sacral foramina and 4 transverse lines between them on the pelvic surface of the sacrum. The posterior surface of the sacrum, named also dorsal surface, is convex. There are 4 pairs of the posterior sacral foramina on the dorsal surface of the sacrum, and also 5 vertical crests are present on this surface. Their names are median sacral crest, intermediate sacral crests, and lateral sacral crests. Each of the lateral surfaces of the sacrum bears a large L-shaped facet named auricular surface for articulation with the ilium of the pelvic or hip bone. Posterior to the facet is a larger area named sacral tuberosity for the attachment of the ligaments that support the sacroiliac joint. The sacral canal is a continuation of the vertebral canal that terminates as the sacral hiatus, which lies on the inferior part of the dorsal surface of the sacrum. The bony pelvis is divided into 2 regions, greater pelvis and lesser pelvis. The greater pelvis, or false pelvis, is superior abdominal part of the pelvis. The lesser pelvis is known as the true pelvis. It is related to the inferior parts of the pelvic bones, sacrum, and coccyx, and it has an inlet, walls, and an outlet. The bowl-shaped pelvic cavity enclosed by the true pelvis consists of the pelvic inlet, walls, and floor. The pelvic cavity continues superiorly with the abdominal cavity and contains elements of the urinary, gastrointestinal, and reproductive systems. The perineum is inferior to the floor of the pelvic cavity. Its boundaries form the pelvic outlet. The perineum contains the external genitalia and external openings of the genitourinary and gastrointestinal systems. The pelvic inlet is completely surrounded by bones. Posteriorly, the inlet is bordered by the body of the first sacral vertebra, which projects into the inlet as the sacral promontory. On each side of this vertebra, the ale of the sacrum contribute to the margin of the pelvic inlet. Laterally, arcuate line on the pelvic bone continues the boundary of the inlet forward. The margin of pelvic inlet continues along pecten pubis to the pubic symphysis. The pelvic inlet in females is circular in shape compared with the heart-shaped pelvic inlet in males. The diameters of the pelvic inlet are transverse diameter, 2 oblique diameters, and conjugate or sagittal diameters. Transverse diameter is maximal distance between similar points on opposite sides of arcuate line of the pelvic inlet. Oblique diameter is measured from the iliopubic eminence to the opposite sacroiliac joint. Conjugate or sagittal diameter is measured between the sacral promontory and the pubic symphysis. The pelvic outlet is diamond-shaped. It is formed by hip or pelvic bones and ligaments. The pelvic outlet is limited anteriorly in the middle line by the pubic symphysis. On each side, the inferior margin of the pelvic bone projects posteriorly and laterally from the pubic symphysis to the ischial tuberosity. Together, these elements construct the pubic arch, which forms the margin of the anterior half of the pelvic outlet. The sacrotuberous ligament continues this margin posteriorly from the ischial tuberosity to the coccyx and sacrum, which form the margin of the posterior half of the pelvic outlet. The diameters of the pelvic outlet are transverse diameter, oblique diameters, and conjugate recta or sagittal diameter. Transverse diameter is measured between ischial tuberosities at the lower border of their medial surfaces. Oblique diameter extends from the midpoint of the sacrotuberous ligament on one side to the contralateral ischiopubic junction. Conjugate recta or straight conjugate is measured from the inferior border of the pubic symphysis to the tip of coccyx. The pelvic inlet and pelvic outlet are located in oblique planes. The pelvic inclination is the angle between the plane of the pelvic inlet and the horizontal plane. In the standing position, it is anatomical position, the pelvic inclination is around 50 degrees in males and around 60 degrees in females. The axis of pelvis is a virtual line, center of all median diameters between pelvic surface of the sacrum and pubic symphysis. The bogle-shaped pelvic cavity, enclosed by the true pelvis, consists of the pelvic inlet, walls, and floor. The pelvic walls contain bones, ligaments, and muscles. The pelvic cavity continues superiorly with the abdominal cavity and contains elements of the urinary, gastrointestinal, and reproductive systems. The perineum is inferior to the floor of the pelvic cavity. The pelvic cavity is lined by peritoneum, continuous with the peritoneum of the abdominal cavity that drapes over the superior aspect of the pelvic viscera, but in most regions does not reach the pelvic floor. The pelvic viscera are located in the middle line of the pelvic cavity. The bladder is anterior and the rectum is posterior. In females, the uterus lies between the bladder and rectum. Other structures, such as vessels and nerves, lie deep to the peritoneum in association with the pelvic walls and on either side of the pelvic viscera. The pelvic walls contain bones, ligaments, and muscles. The ligaments are sacrospinous and sacrotuberous ligament. These two ligaments connect the sacrum to the ischium. The sacrospinous ligament, originating from the lateral margin of the inferior sacrum and attaching at the ischial spine, assists in resisting external rotation forces of the pelvis. The sacrotuberous ligament has a broad origin from the posterior superior and posterior inferior iliac spines and the entire lateral margin of the posterior sacrum. The sacrotuberous ligament curves posteriorly to the sacrospinous ligament, inserting on the ischial tuberosity. These two ligaments convert the greater and lesser sciatic notches into same-name foramina. The joints of the pelvis are sacroiliac joints and pubic symphysis. The sacroiliac joint is synovial joint between L-shaped articular facets named auricular surface on the lateral surface of the sacrum and similar facets on the iliac parts of the pelvic bones. The joint capsule of each sacroiliac joint is stabilized by the anterior sacroiliac ligament, the interosseous sacroiliac ligament, and the posterior sacroiliac ligament. The sacroiliac joints poses little mobility because of their role in transmitting the weight of the most of the body to the pelvic bones. Movement is limited to slight gliding and rotatory movements. Pubic symphysis joins the pubic bones. The surface for the pubic symphysis is linked to adjacent surface by fibrocartilage. The superior pubic ligament and inferior pubic ligament are associated with the pubic symphysis. At the anterior surface of the sacroiliac joint is visible anterior sacroiliac ligament. At the posterior surface of the sacroiliac joint is visible posterior sacroiliac ligament. Nutation refers to anterior-inferior movement of the sacrum, while the coccyx moves posteriorly relative to the ilium. Contranutation refers to a posterior superior movement of the sacrum, while the coccyx moves anterior relative to the ilium. The muscles of the pelvic wall are obturator internus and piriformis muscle. The obturator internus forms a large part of the anterolateral wall of the pelvic cavity, while the piriformis muscle forms a large part of the posterolateral wall of the pelvic cavity. The both muscles insert on the greater trochanter of the femur. The obturator internus muscle exits through the lesser sciatic foramen, while the piriformis muscle passes through the greater sciatic foramen. The pelvic floor separates the pelvic cavity from the perineum. It is formed by the pelvic diaphragm. The pelvic diaphragm consists of the levator ani and coccygeus muscles. Two levator ani muscles attach at the periphery to the pelvic walls and join each other at the middle line by a connective tissue raphe. Together, they are the largest components of the pelvic diaphragm, which is completed posteriorly by the coccygeus muscles. The pelvic diaphragm forms most of the pelvic floor. The pelvic diaphragm, in its anterior region, contains a U-shaped defect, urogenital hiatus, which is associated with elements of the urogenital system. The anal canal passes from the pelvis to the perineum through a posterior circular orifice in the pelvic diaphragm. The pelvic floor is supported anteriorly at the region of the urogenital hiatus by the perineal membrane and muscles in the deep perineal pouch. The levator ani muscles are divided into three parts: iliococcygeus, pubococcygeus, and puborectalis muscle. This is superior view of the pelvic diaphragm of male. This is superior view of the pelvic diaphragm of female. This is inferior view of the pelvic diaphragm of male. This is inferior view of the pelvic diaphragm of female. The perineum lies inferior to the pelvic floor between the lower limbs. Its margin is formed by the pelvic outlet. An imaginary line between the ischial tuberosities divides the perineum into two triangular regions, the urogenital and anal triangles. Anteriorly is the urogenital triangle. It contains the roots of the external genitalia. In females, the urogenital triangle contains the openings of the urethra and the vagina. In males, distal part of the urethra is enclosed by erectile tissues and opens at the end of the penis. Posteriorly is the anal triangle. It contains the anal opening. Structures of the pelvic floor intersect with structures in the perineum at the perineal body. This purely defined fibromuscular node lies at the center of the perineum, approximately midway between the two ischial tuberosities. The perineal membrane is a thick triangular fibrous membrane that fills the space between the arms of the pubic arch and has a free posterior border. It divides urogenital region in two different layers. Above perineal membrane is located deep perineal pouch, while below perineal membrane is located superficial perineal pouch. Muscles of the deep perineal pouch are external urethral sphincter and deep transverse perineal muscle, while muscles of the superficial perineal pouch are superficial transverse perineal muscle, bulbospongiosus muscle, and ischiocavernosus muscle. Anal triangle contains external anal sphincter. Here are muscles of the superficial perineal pouch in male, muscles of the superficial perineal pouch in female. Here are muscles of the deep perineal pouch in male. Here is perineal membrane in female. As I said before, perineal membrane is a thick triangular fibrous membrane that fills the space between the arms of the pubic arch, and it has a free posterior border. The fasciae of the pelvic floor are superior fascia of the pelvic diaphragm, which covers superior surface of the pelvic diaphragm, then inferior fascia of the pelvic diaphragm, located at the inferior surface of the pelvic diaphragm. The next is perineal membrane and superficial perineal fascia. The ischioanal fossa is a wedge-shaped fat-filled space situated on each side of the anal canal below the pelvic diaphragm. The two fossae communicate with each other behind the anal canal. They help in dilatation of the anal canal during defecation. The base of the fossa lies on the skin over the anal region of the perineum, and the apex is directed upward and laterally. The lateral wall of ischioanal fossa form fascia covering the obturator internus muscle and ischial tuberosity. At the inferior border of the lateral wall of the ischioanal fossa is located pudendal canal. Inside this canal are situated internal pudendal blood vessels and pudendal nerve. Medial wall of the ischioanal fossa form fascia covering the levator ani muscle and external anal sphincter. Posteriorly is sacrotuberous ligament on the posterior surface of which is gluteus maximus muscle. Anteriorly is posterior border of the perineal membrane. The floor of ischioanal fossa form perineal skin. Ischioanal fossa contains ischiorectal pad of fat, inferior rectal nerves and vessels running from lateral to medial side, and perineal branch of fourth sacral nerve enters the posterior angle of the fossa, running over levator ani muscle to reach sphincter ani externus, which it innervates.